help lessen trauma in immigrant children. According to Nina Markula, who is a researcher at the International Institute of Health and Welfare, in 2017, there were 258 million immigrants, with 37 million of those immigrants being children. That's 14%. Unfortunately, that number was not meant to remain so low, because in 2018, according to UNICEF, of the total immigrants, there were 50 million children, and that is 40%. The most recent study was conducted by the United Nations High Commissioner for Refugees, or the UNHCR. They found that 1 in 108 people wind up being forcibly displaced or refugees, and 30 people are displaced every minute. Now, it is important to make the distinction between refugees and asylum seekers. Asylum seekers are those who are given temporary protection from the country that they go to. And while refugees are given permanent visas in the countries they flee to. Now, this is important to make because an important distinction to make, because refugees are oftentimes those who are already successful or are just rich in general. And this calls into question the fairness of the American immigration policies. Now, this is also could be a semi-solution, and I say semi because it won't affect everyone, but it will affect a lot of people, and will help take off the amount of people who are in these detention centers needing to be observed. The refugees can also work, which will help the economy. Now, this is for all immigrants. However, there are even more terms when referring to children.
So there are 3 different types of immigration. According to the International Society for Social Pediatrics and Child Health, children either migrate for safety, to rejoin family, or to seek better lives, or even sometimes a combination of all 3. The first type of child immigration is the immigration with parents. This is usually due to violence back home, accompanied with the want for a better life. The second type of child immigration is immigrating alone. This is usually due to the want for a better education and overall a better way of living. The third type of immigration is when a child is left behind in their home country by their parents who tend to leave for financial reasons. These parents tend to send money back to their children in their home country. However, these children continue to live in poor conditions. These people, according to Jan Catherine, the absence of parents and challenges of rural life make these children particularly vulnerable to major health risks. These people usually immigrate for employment opportunities, to escape violent conflict, environmental factors, and to reunite with family. Another aspect of child immigration is forced displacement. Forced displacement is the involuntary migration of individuals, which is usually due to armed conflict. According to the UN Refugee Agency, children make up 1/4 of the 65 million displaced people worldwide. Despite how these children immigrate, they are all forced to face the same trials. This includes detention centers and the poor conditions that are associated with them.
Detention centers are the main holding facilities for individuals, especially children who are immigrating into America. The Health and Human Services Agency says that it currently has 13,500 children in its care, and the Border Patrol said that last month 11,200 children crossed the border without a parent. While migrant children that are held in these facilities are supposed to receive food, medical care, and schooling, there have been widely shared images of them being held inside fenced enclosures with limited resources. These facilities are secured like prisons, which can also become breeding grounds for diseases and can be extremely unsanitary. Conditions like these can lead to deadly illnesses, which in confined spaces such as these centers can lead to mass numbers of sick individuals. This is why many people have begin to suggest that there needs to be alternatives for these current centers. After doing research, we found that a potential solution was to incorporate alternatives to the current detention centers into society and to eliminate the current centers. research, we found three best solutions. The first being foster care. Foster care would allow children to be placed into a ward, group home, or with a state-certified caregiver, and would allow them to become educated and develop like a normal citizen would. The second alternative that we found was the VERA program, which is a program that is working towards national supervision. This means that children and their families would be able to live freely in America with supervision rather than being held inside a detention facility. This would yet again allow a child to become educated and develop like a normal American citizen would. And the third alternative we found was community-based alternatives, which basically means that it would be making detention centers more like homes rather than like prisons. However, there are limitations to all of these alternatives. For every alternative, the main issue that we found was that these alternatives don't seem as beneficial enough to replace the current facilities. The current facilities are simple and easy to manage, and implementing the new facilities would be extremely costly as well as be difficult to implement into society. Another solution that we found would be to the immigration crisis was to provide guidance within the detention centers.
The best solution that we found is to offer guidance in detention centers. This is meant to teach immigrants how to live and thrive in their new country. Currently, immigrants are left to provide for themselves and live on their own, and providing guidance will teach them how to live their new life. According to the International Society for Social Pediatrics and Child Health, preventative and curative care should be available to all children and pregnant women, regardless of their legal status. This includes routine pediatric care, perinatal care, the care of medical conditions related to migration, and health education. The second is to provide migrant children and families access to health information in a language that they can understand. For example, practices that are sensitive and appropriate to the cultural, spiritual, and religious background of the patient should be respected. Professionals working with migrant children and families should have access to services for emotional support. Providing emotional support to these professionals will help them better understand what's going on in these migrant children's lives. With the aspect of offering guidance to detention centers, we also found a few limitations. This includes that we may not be able to find these people that are integral to the implementation of these immigrants in their new country, such as cultural mediators or teachers. The second is that we may not have the money to fund programs as well as fund the people that will work there. The third is that the implementation of these programs may cost too much.
Over the course of history, America has been blessed with prosperity and wealth. Now, and as the old proverb states, to whom much is given, much must be expected. Although many will argue that America comes first, and that it isn't our responsibility to take care of these children and their families, it is, we don't have enough people in the Americas to take care, or to do all of the jobs here, which means it'd actually be economically better to have more people in this country. This is why many have suggested alternatives like the VERA program to detention centers, because detention centers, as we have just said, are very cruel oftentimes. However, the best solution to detention centers and the most cost-effective is providing guidance within these detention centers. These solutions aren't perfect by any means. However, they can be improved upon. Thank you.
Okay, Kate, describe how the content of the team presentation was changed as a result of group discussions.
So once we all finished our individual reports and our documents, we realized that in our presentation we wanted to mention the aspect of detention centers. We did, each one of us I think had a few parts in our papers that did have to do with detention centers, but it wasn't a big aspect. So we decided that in our presentation we wanted to build up on that. So we decided to add the fact that 6 migrant children have died so far, and like detention centers and a lot of things like that that we didn't have in our paper.
Sydney, how did the group decide to include Paige's perspective, lens, conclusions into the overall presentation?
Well, for one thing, we decided to include the VERA program. So the VERA program came from her research, and we realized that that was an alternative. Originally, we had only had the foster care and making them more detention centers, more like homes, group homes. So we included the VERA program because when she had mentioned the VERA program in her research, it was unique and to the other solutions that had been suggested. So,
Paige, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
I think Sydney's overall perspective and research had the greatest impact upon me because I understood the like physical side of the issue and like the medical and education like Kate and I did. But since Sydney did the medical aspect of the trauma with children, or the mental aspect, I never really thought a whole lot about the mental trauma that they went through, and just conversing with Sydney and reading her research just really had the greatest impact of my understanding.